Hello and welcome to The Intentional Clinician. I'm your host, Paul Krauss, licensed professional counselor. In today's episode, I'm going to be meeting with Randy Webb. We are going to be discussing the idea of trauma-informed care and modern integrated therapy. Probably a lot of other things as well. So Randy Webb, we've got a lot of credentials behind your name. We've got a master's degree, I believe, in linguistics.
That's correct.
A master's degree in counseling psychology.
In counseling. Mm-hmm.
In counseling?
Yeah.
And you're a licensed professional counselor.
That's correct.
And a licensed mental health counselor.
That's true.
Okay. You're also, tell me about the facilitation you do in training.
Well, I work as a facilitator and a trainer in training with the EMDR Humanitarian Assistance Program.
Okay, excellent. I think you also do some Ericksonian trainings as well.
I do. I historically have done that in conjunction with any number of different organizations, but now do that really just all over the place, kind of as a needed basis in the community.
Okay, excellent. And I also see you're also a learning consultant. What is that?
That's my official title with the organization I work with full-time, and my job is to work helping the community, workforce development, help practitioners and clinicians from different disciplines, including physical health, and with the community members themselves.
That's right. So you work with a large organization. It's a health care organization, and they manage a large area. I'm not sure if you're allowed to talk about them on the podcast of who exactly you're working for, because you'd be representing them. But it's a very large, how many members get care through you guys?
Oh, tens of thousands of people. And it's with the new contract coming out this year with the state's Medicaid program, we'll be really the managed care organization for Maricopa County, Gila County, and Pinal County.
Okay, and for those listeners who don't know where that is, we're actually recording this interview here in Central Phoenix and in Arizona, and where I've lived for a long time, and now I'm kind of an early snowbird, and where Randy has lived for, how long have you lived here?
Altogether, over 30 years now.
Okay, so tell me, when did you first come to Arizona?
I came out to Arizona in 1984 to go to graduate school in linguistics at the University of Arizona.
Okay. Yeah. And then I've understood you got more schooling after that as well.
Right. Well, what happened is I had an opportunity. A number of things happened that led me to Tempe, and I was a doctoral student in Spanish American literature, and I wasn't a very good doctoral student in Spanish American literature. So I wouldn't stay in the library. So I had a director of graduate studies say, Randy, your students really like you. You're doing a great job of teaching Spanish. I'd grown up and had a lot of exposure to the Spanish language. And so my students were coming to me for advice all the time, and whenever they'd run into kind of problems, they would come to me. And the director of graduate studies noticed that, and he said, maybe you ought to take some classes in social work, education, something like that. And I took a group dynamics class, and the rest is history. I've been involved in behavioral health ever since, and that was 1991.
Oh, wow. Okay.
Yeah.
And so then did you get your master's of counseling right after that?
Right. That's when I did that, and haven't looked back. I've had all kinds of great experiences with that. So, yeah, it's been very rewarding.
That's wonderful.
Yeah.
Yeah. So this is something I usually do in podcasts with interviews with people I know is how do we know each other?
I think you and I may have first crossed paths. Maybe it was with me training in the community, but I'm guessing we were both getting trained in EMDR back in 2011. I think it was then.
Yeah, that was the second EMDR training through the Humanitarian Assistance Project or program.
Programs, yeah.
And we did meet there in Mesa, and we went through that training together. But it was actually really funny because when I first came to Phoenix in 2008, you were the large organization that will remain nameless's trainer for a lot of classes, a lot of introduction to how to help people. And I was thinking, oh my gosh, this is better than some of the stuff I got in grad school. And I'm in here with a bunch of people. A lot of people had bachelors, some had masters, because there was a lot of case managers involved. And I was working in the counseling department at a organization. And I remember thinking, why aren't they teaching this stuff in grad school? I didn't learn half of this stuff, and it really helped me. So then I remember telling people, they're like, oh, we have to go to blank organization to get training. I said, just sign up for Randy's class. And they're like, who's Randy? I'm like, I don't know, but he's cool, and you should go to his class. And then that's how I remember I went to I think I went to all your classes. But I mean, it was 30 or 40 people in the classroom. At that time, you were meeting over in Tempe in some kind of disheveled buildings.
Oh, right. Yeah.
That was a long time ago.
It was an old clinic. It was an old clinical building that had been converted to kind of a training center.
Okay. Yeah. So that's how I first met you. And then we've kind of just crossed paths for the last 10 years. This is 2018 now, in various ways. And you know people I know, and I know people you know, and social media and things like that. So,
absolutely. Right.
And then, of course, the EMDR training, which was amazing.
Oh, yeah.
My second one. The first one, I think, was in 2009. And I didn't even get around to taking part 2 till 2011. And I was like, oh, my goodness, I really should have done this earlier. So yeah, and then when you grew up, I want to move into that, but I want to know a little bit more about you. And you grew up kind of speaking Spanish in a school. Is that what it was?
Right. What happened is that I grew up in Atlanta, and we happened to have all kinds of people who had moved to the area, whose families had moved there. Maybe they were refugees from other countries, and there was this glut of folks who spoke the language, had some teaching experience. Maybe they were relatives of the people whose family members had actually moved to that part of the world. And somebody had the idea, hey, we have these folks, and would they be willing to teach these children in more than one language? And so from the time I was 8 years old, whenever there was funding, there were a lot of political things that would have influence over that. We could get instruction in both English and some other language, and I chose Spanish.
Oh, wonderful.
Yeah.
And so I know that you speak Spanish just because I speak un poquito, and I can mostly just overhear people's conversations and understand it because I don't remember any of the conjugation from all my 6 years of taking it. Right. But I remember that you would flip into Spanish language in the courses afterwards when somebody would come up to you and ask you a question and somebody knew you spoke Spanish and just you went right into it. And I said, oh my gosh, I didn't even know you spoke Spanish. But that's pretty fun. So I was curious, how is that learning Spanish? How has that helped your career or your personal life or anything like that?
I have a suspicion that it affected my brain development quite a bit. I have the suspicion that it gave me a lot of shades of gray about how to experience the world. I think there's something really cool happens to a person when you get exposed to more than one way to express something, or maybe you, as a result of being exposed to language and the people who speak it and the many different varieties that they show up to describe things and describe their experiences, I think lends itself beautifully to developing all these, I might say shades of gray, but maybe shades of many colors about how to describe things and experience them. I think it has a good effect.
Yeah, absolutely. Yeah, I remember when I spoke Spanish a lot more, I had traveled to Spain and also Mexico, and I found it really, really fun to speak in Spanish, although mostly about elementary school type topics because of my vocabulary. But it was really interesting because I remember I kept thinking when I was learning Spanish, all their sentences are backwards, is what I kept saying. It's backwards to me. And I actually think that's interesting because we have our way of speaking, which we think is, we grew up here and it's one way. But then in Spanish-speaking countries, they're saying the same thing. They're just saying it slightly differently, and it's almost like a symbiosis to English. I almost think that way. I'm not sure what that means, but that's what I noticed.
I would think that's very true. In fact, I find, and I notice this with folks who have been exposed to 2 or more languages, is that you might sometimes notice they'll start with one, in the middle of the sentence being another. They weave all that together. They make the syntax work, and it's just fascinating. And I noticed that I might more borrow a word from Spanish, for example, that seems to convey some meaning, some nuance that maybe I wouldn't achieve in English. And to be frank, I oftentimes get reminded after all these years of using both languages that there's a certain subtlety and nuance in both languages that I try to find in the other and don't always find. It's pretty interesting. It's an interesting experience.
Yeah, that's awesome. I think that's probably also lending to your clinical skills as well, just sort of seeing things from different angles. And like you said, many, maybe not even shades of gray, but also many shades of color as well. I
think so too. In fact, I think it may be when I was getting trained by the Ericksonians, by the Erickson Foundation, I have a suspicion that quality, those qualities, the skill at doing that maybe I'd even taken for granted to some degree, I think kind of helped me learn more about how Milton Erickson did what he did, the magic and the way he expressed things, the way he constructed what he was going to say, his intention, his strategy. I think that was one thing that I think it enhanced that experience a lot, actually.
Excellent. Actually, I'm really excited that you brought up Erickson because I know that we're going to get into this whole trauma-informed care when I kind of ask you about what you're doing now, but I would love to know a little bit more about your experience at the Erickson Institute. And I know that you've done Ericksonian hypnosis trainings because I went to that, and I've actually, I never went through the full Erickson training, but I've taken some of their scripts and some of their ideas and utilized them in my practice, which was quite helpful. I should probably get the full training at some point. But could you tell us a little bit about your experience with the Erickson Institute and what that is?
Well, the Milton H. Erickson Foundations had a huge influence on, you could argue, on generations of helpers and among those psychotherapists. The experience I had with them was pretty remarkable. I had taken an ethics class at Arizona State University, and I don't know what got into me. I think I just had some exposure, a little bit of exposure, and this was back in graduate school, so this was the early 90s. I had seen Jeffrey Zeig, who's the director and founder of the Erickson Foundation, speak at ASU once, but there was something that happened. I even to this day, I sometimes wonder that maybe Zeig had planted some sort of seed, it used some beautiful technique with all of us in attendance. And I found myself quite suddenly just having this idea of I should study the ethics of hypnotherapy. So I did this course and I did this presentation and did some research about the ethics of hypnotherapy or clinical hypnosis, and that led me to the Erickson Foundation. And not long after that is when I started getting training with those guys. So I think I believe that's my working hypothesis as to how I got started.
Okay. And that was only about 12 years after they had started the conference, which is known now as the Evolution of Psychotherapy.
That's correct.
1980, was it?
I think the first one was 85, 86,
okay.
actually. Mm-hmm.
Right. Okay. And then they also have the Brief Therapy Conference. And if you're out there and you're a clinician, I really recommend going to either of those. They probably have other ones too, but check out, it's called the Milton H. Erickson Foundation. Yeah, so, check out their webpage. Yeah. They're excellent.
Right, that would be Erickson-foundation.org.
Oh, okay.
I see it a lot. I'm always checking to see what else is going on. And they do a couples conference as well.
Oh, of course, they do a couples one. Okay.
And they're the big sponsor, they're big organization that is behind the Evolution of Psychotherapy Conference. It happens every, 3 or 4, sometimes 5 years. And these days, it seems like the last few have been in Anaheim, California, at the convention center right across the street from Disneyland. So it's a great venue for them to do that.
I agree. I went to it. I missed the last one, but I went a couple times ago, and it was wonderful. It opened my eyes since I got to see all my heroes. I saw Hillman when he was still alive. That was amazing.
That's beautiful.
But yeah, tell us a little bit more about Erickson, just a little bit more about your experience there. That would be excellent.
Well, what happened to me, by the time, it didn't take long for me to get this idea that maybe Erickson was a magician. Mm-hmm. Milton Erickson had this remarkable skill at observing people, getting an idea as to some indications of their internal states, how they think, how they feel, watching closely as how they behave. There are all kinds of stories about Milton Erickson, a bit of a legend, right? He had influenced so many people, had taken on so many students, right? Like Bill O'Hanlon and Watzlawick and Nardone and, Chloe Medanes and Dan Short. There's just so many people, right? Stephen Gilligan. There are all these people who had worked with Erickson, watched him work. And my experience of him and seeing some film, some demonstrations, of course, a lot of things written. His scripts, like you mentioned earlier, just remarkable. His skill at, who am I leaving out? Rossi, Ernest Rossi, Michael Yapko, a virtuoso of these techniques, just remarkable.
Yeah, Ernest Rossi and his wife, who are both geniuses. I think.
They're amazing. Yeah. Catherine, they're just I'm leaving out so many people. They're all just amazing in their own right. And what is so cool is that they watched Erickson work. They would see how he would seem to refine, like he was so wonderful at condensing what he was going to say, how he was going to make everything he said so efficient, serve more than one function. And he would deliver these things, and then he would be willing to change them on the fly. So there are all these stories, many of them are probably apocryphal, about how he did these miracles with people, and somehow influenced them into doing all kinds of things. So you could see his verbal communication, funny how I describe it, C is nonverbal, hear is verbal communication, how we wove all that together just amazingly. And there are all kinds of, like I say, there are all kinds of stories about him taking, for example, okay, he had an idea that he was going to meet with somebody. Then he takes some data down about the person, and then he gets some other information, and he asks these questions, and he watches how the person behaves, and he hears how the person talks, and he gets a sense about the person's preferred senses. Well, that sounds really good. I see what you mean. Something smells fishy. Something doesn't smell good here. Mm-hmm. And he would take all these things and then weave them together, his experience of a person, weave them together in this highly condensed, highly efficient form of communication, what he was going to say, what he was going to show. And then he'd think about it and he'd condense it. He would take 10 pages of something and turn it to 5, and then turn 5 into 2, and then 2 into 1. And then he would deliver this, and then he would see how the person would react. And then he would see how the person reacts, and he would change it on the fly. And one of the many things that the foundation in their training of us would get across is it's important to be strategic. It's important to be intentional. Think about what you're looking for, and then be willing to change it.
Absolutely. I love that. Yes. And I remember he used to use, was this him that used the language where he would sort of say, I would like you to not stop smoking.
Oh, yeah.
And he would just do these little wordplay tricks and
remarkable.
Really fun stuff. And didn't he have polio or something as a child?
That's correct. He had polio, and then he had post-polio syndrome over the rest of his life. And there are all kinds of stories about how Erickson really was using these strategies and techniques to manage his own physical pain. It led him to these remarkable insights about how to manage his experiences, how to influence how his organism was working. Just remarkable.
Yeah, he's such a big figure because he didn't necessarily found a school, would you say, of psychology, but he kind of did a lot of different things. He did hypnosis, he did kind of what we would call psychotherapy, right? Would you call it that?
Absolutely.
Or some sort and he did a lot of other things, but he didn't really start one of these schools that became later like CBT, cognitive behavioral therapy, or client-centered therapy, or these things you learn in graduate school. Right. And so sometimes I feel like he gets left out, and then we go, oh yeah, well, Erickson too, but he influenced so many people that have revolutionized the field, including Bill O'Hanlon and Jeffrey Zeig and everyone you've been talking about. And it wasn't a coherent school. So I almost feel like he does fit into this sort of modern integrated form of therapy we're going to talk about, although without, they didn't have all the information about trauma we have now.
I couldn't agree more, Paul. I think it's a really good insight. Jay Haley wrote in Uncommon Therapy, and in other places too, Jay Haley, the strategic family therapist, describes beautifully how Erickson's, maybe his greatest contribution, Jeff Zeig is probably most credited with promoting the idea that Erickson's idea of utilization, making use of whatever the person brings to the situation, indications of the person's values, motivations, indications of the person's culture, family culture, and these just beautiful, beautiful notions about making the most of, instead of lamenting what people lack, to really focus on what their strengths are, what their motivations are, and to customize what we do to maximize that. It's just beautiful. It's just remarkable. And the life he lived, you could say in a lot of ways, as Jeff Zeig has done such a beautiful job promoting Erickson's life, was how Erickson could have decided he was just going to perceive life as just suffering, instead of, well, you know what? I've survived this condition. I'm still alive. There are beautiful things I can do. The rest of it is just wonderful. I can do all kinds of things. So many of the things coming out of the way he did that and influencing so many people who wound up, like you say, from a solution-focused standpoint, a brief therapy standpoint, including the family, getting different perspectives as opposed to seeing people as, well, they're going to present all these potential problems, to more think in terms of, okay, well, that becomes more grist for the mill, and what are the strengths that I can build on, and what kind of ways can we build a collaboration that increases the chance that we're going to elicit or bring up. The purpose of the communication is to bring up people's strengths, bring them to the surface to be used.
Right. And then you just said, I think, did you say collaboration? Is that what you said?
Yeah.
And I think that's the key point of a lot of what we're going to talk about is that nothing will work unless you collaborate with your client, and that kind of taking them through a rote model or workbook therapy, it won't work unless you have the connection, which that I've had a whole podcast on that, but it's got to be collaborative. I mean, if you think about yourself going into a doctor's office, if he talks to you kindly about your diet, or she, excuse me, about your diet or what options to do about this or that, you're going to be more apt to cooperate. But if they come down with the hammer and say, well, look at these problems, quit complaining, or you need to quit eating that food, you're probably going to be a bit bristling. So I think Erickson not only could read people and all of that, I mean, and you've studied him more than I have, but he really was able to collaborate and take his ego out and put it somewhere else where he wasn't feeling threatened by anything much that his clients were bringing back at him. He would throw out a whole script. He would just go from whatever, and he would be able to work with pretty much anybody. That's why I think he was a miracle worker, because other therapists would have problems, I think, because they were stuck in their perspective of what was going on instead of listening to the client and getting a more vast understanding of what was going on.
That's a beautiful point. That's exactly how I would describe it, as he saw the relation. Well, it's interesting. Scott Miller, who has done so much to promote these ideas of the best predictor of good outcomes is the relationship. The best predictor of poor outcomes is the ego of the helper.
Right.
And how he studied with Erickson, and I think Erickson, there again, did such a beautiful job of, and I couldn't agree with you more, it was less about model. It was more about a way of building relationships and collaborations with people. When he watched how people were doing clinical hypnosis early in his career, before he went and did the work he did, like in Michigan, for example, where he was watching how people were doing it, and he saw, hold a second, it seems like you're just really busy trying to stick ideas into people. Could it be that the ideal communication is one where the goal is to build that relationship or to build that collaboration, and for me to elicit, leading to the notion that we oftentimes call as elicitation. So it's ironic, we were talking earlier about the two of us going through EMDR training, eye movement desensitization and
Right.
reprocessing. And it's pretty interesting because I think, and I call myself an Ericksonian, it's kind of funny because it's not really a school, so per se, like you were mentioning, it's not really
Right.
a model. But there seems to be something that kind of unites Ericksonians, and I suspect that's what it is. It's interesting because the Mental Research Institute in California has historically had close ties with the Erickson Foundation. Well, isn't it kind of interesting? We Ericksonians will say, well, when Francine Shapiro was working with families and doing her thing with the Mental Research Institute, she was studying folks doing all kinds of things, using different methods of doing things very efficiently, getting at the core, getting at people's strengths and values and internal resources. When she invented EMDR, when she was developing that, was in the context of doing something with an organization that we Ericksonians consider to be very close, have very close ties with the institute, with the institutes around the world, but the foundation here in Phoenix. So it's kind of interesting. And so when I take that kind of Ericksonian, for lack of a better term, this approach, this way of thinking, or these ways of thinking and feeling, experiencing people, I look at EMDR. I remember the first time coming across it, and I went, it seems a bit intimidating because the protocol seems kind of technical. It seems like it, in fact, my first experience was kind of rigid.
Sure.
Now, in retrospect, I look more at the standard protocol, the standard practice as being more like one of Erickson's scripts that can be changed on the fly in service of the relationship.
Right. Oh, I like that. So that you actually went somewhere I wasn't going to go, because I was actually thinking, I see the EMDR protocol as sort of a framework idea. Maybe I'm saying the same thing as you, like a framework of how to understand certain people because of the adaptive information processing model.
That's lovely.
But everybody's adaptation information processing model is different, A, and B, everybody's way that they process, there's some people that process the same, but almost everybody's way of processing is different. And so we have to get at the core. And so what I think trips up some EMDR therapists is they'll be doing the standard protocol, and somebody will shut down or get too emotional or want to talk about something else or discontinue therapy or whatever, and they're not figuring out how that person is responding to having to go through this type of therapy, which is, can be very traumatic to go through. And so I think that's where we have to use that we'll use Ericksonian, that kind of, what is the reason? What's the core? What's going on here? What can that person teach me about what their experiences here, so that I can use these tools, which are coming from the neuroscience, then interpersonal neurobiology and developmental psychopathology, which we'll talk about kind of in the part where we're talking about the trauma-informed care. How can we take these tools which are developed on that brain science and apply it to this person? Because they can't just fit in a mold of the protocol book.
Agree.
Not everyone's just going, I fell down the stairs and the rest of my life was bliss.
Right. I think it's a great way to describe it. I love the way you describe it. When I'm working with consultees who are learning, or with trainees who are learning EMDR maybe for the first time, I approach them from that standpoint, my interpretation of being Ericksonian about it, just to put a label on it, of, okay, so maybe you're learning the standard protocol, maybe you're committing these things to memory, maybe you're following the script, if for nothing else, to habituate the language, to habituate the way you do it, to habituate or to get used to kind of create pathways perhaps about, okay, here's that framework. But you're certainly not limited to it. And it's kind of ironic because in the first weekend, or the first part, just to call it something, because you have part so many people, part one, you have so many people doing EMDR training, even connected to the International Association. It's kind of funny nowadays in training, we will tend to say, okay, we're a bit rigid, to use kind of Dan Siegel's terminology. We're a bit rigid to begin with, kind of black and white about it. And then when we get some indications that maybe if they've had some consultation, there's all that business about standardizing to a certain degree. It's kind of comical from an Ericksonian or from Randy Webb's experience of Erickson, is by the second weekend, Paul, kind of like and that's where, you and I were getting that's part 2 training in 2011. It's kind of funny that by then we're suggesting to them, even in training, okay, now that we have you kind of getting used to this a little bit, now let's remember how to be a good helper.
Right. Yes, exactly. So almost these 2 words jumped into my head while you were saying that. Here's the science.
Right.
Now you can use the art.
Exactly.
Now you can apply the science through art. But you have to know the science, and you have to be rigid and stick to this because you don't want to hurt people.
Right.
And you don't want to open people up who aren't ready for this. And we want to use all those skills of stabilization and all these things to help. And then now you can open up and use your creativity now that you know what this does for the brain and what this does for the person and this experience. So those are the 2 words that were jumping into my head. And we'll just name drop further for people who are looking for training. I don't know, I should go look at how many hours this was, but I think it was like 20 or 30 hours with Sarah Jenkins and Kathleen Martin.
Wow.
On complex dissociation.
Wow. Impressive.
And that was fun. And they kind of took some stuff. I shouldn't say that. They had things similar to internal family systems or ego state, but it wasn't the same. And it really helped me. I actually now use that as my part of my phase 2 of EMDR, because I feel then when people get an understanding of that, then it's easier to introduce, phase 3, identifying the trauma, and phase 4, and the famous part.
Oh, that's lovely.
So I wanted to, just for I know you love training, so
oh yeah, absolutely. I think Sarah's remarkable. Yeah, that you're talking about some just beautiful stuff that Sarah's doing. Yeah, very impressive.
Excellent. So this kind of is a good segue, because right now you are doing a lot of training, of course, like normal, and you're a teacher, but you are now doing. Are you doing the humanitarian assistance program yet, or are you for the EMDR training?
Right. So the Humanitarian Assistance Program, the Trauma Response Network, has had me. Last year was a year that I was going through the process of becoming what is called a facilitator. There's an interesting kind of structure with the International Association, the EMDR Institute, with the Humanitarian Assistance Program. So training is something that they do, right? And so there's this. The way it happens is you have a person who's the main trainer, who presents things, as you might recall, you have this person who's presenting these things, going through they called it a lecture, but it really is many things. It's question and answer, and it's a lot of things. And then in the afternoon, folks get a chance, clinicians get a chance to practice EMDR. And so I'm in that role of leading the practice session with a subgroup of the main class each time. So with the basic training. So, and then I'm in the process of being trained to be one of those main trainers. So there's a process for that too, where they have us get some ideas about strategies and techniques of handling certain things in the morning sections, and then leading the practices in the afternoon as well. So you're really a facilitator, and you're doing that the first half of each day of the basic part 1 and part 2 training of leading that discussion and exposing some concepts and doing those things.
And so then you're going to take that training once you become the main facilitator. Are you going to travel as well?
They'll keep me traveling. I'm traveling a lot already.
Okay.
And they'll keep me traveling. I get to travel to Washington, D.C. and go through the training of the trainer process for part 1. I'll get to go back in November for part 2. And then there'll be people. That's how it works with EMDR training, right? Is when you're becoming the facilitator, then you observe, then get observed, observe, get observed, and the same thing with being a trainer. You observe, you get observed, observe, get observed.
Oh my gosh.
And there's this kind of, it's an interesting kind of peer review that goes on. It's pretty interesting, very intense actually.
Oh, that sounds fun. It sounds right up your alley since
I love it.
your main gig is an educational consultant.
Oh,
right?
absolutely.
And so I think
Absolutely.
this sounds like fun. I would love to be in your class, but yeah, so if you
Who
come to
knows?
Michigan, maybe I'll sit in.
Who knows? We travel all over the place. We go all over the place.
I'm trying to get all of the clinicians I work with in Grand Rapids EMDR trained, or at least somatic experiencing trained as well, because
beautiful.
There's a big need for that in Michigan, and I'm going to try to possibly even do a little bit of getting involved with the Institute a little bit more. EMDRIA, probably. I mean, I'm on the EMDR webpage if you look me up on Find a Clinician, but I'm trying to get involved to bring more training, because I think I've been just the more and more I've been a clinician for now over 8 years. I've been getting this theory, and I don't think I'm the only one who has it, but I don't think I can articulate it as well as a scientist, but that the trauma, when somebody experiences trauma, no matter what age they're at, and especially when they're a child and their brain's growing, there is this, that may be the impetus of why almost every diagnosis in the Diagnostic and Statistical Manual presents itself, such as anxiety, general anxiety disorder, major depression, obviously post-traumatic stress disorder,
Sure.
bipolar disorder. That the beginnings of this, now there's other genetic and biological and sociological components and personality components and all that go into it, but perhaps this might have been, in a lot of cases, the tipping point that tipped people into what we would see, what they could go into their generalist doctor and they say, oh, you have generalized anxiety disorder, take this SSRI because that's indicated in anxiety as well as depression, and I don't want to give you a benzodiazepine, so here you go.
Right.
Then that person goes and they function, but we haven't gotten to the roots.
Right.
And so I know this is your wheelhouse.
I love this stuff.
So I wanted to get into a little bit about your idea, which was the trauma-informed care and modern integrated therapy. I think you said 21st century integrated care and therapy. And I wanted to just throw a few things out and then let you kind of take over. So the reason we know this, just for the listeners, is there has been an explosion in science, in research science. I believe part of it started with the Adverse Child Experiences study, which I talked about in a previous podcast, I believe the episode right before this one, ACEs study, which tracked people for a long time, but it did a short-term and long-term tracking, finding that the number and severity of adverse child experiences not only could cause trauma, which could lead to some type of mental health diagnosis, but also was the correlation was the more you had of these traumatic experiences and adverse child experiences, you had more indicators that you would be a smoker, that you would use drugs, that you would get pregnant when you were a teenager, that you would be obese, that you would have diseases, heart diseases, that your diet would be fast food and junk food. There's way more to it, but it's a scientific study that's showing this. And so a lot of times people get shamed, or in our society, for not being, it's a moral failing, or maybe we slam them for being ignorant, or we slam them for being obese or not having certain skills, when actually what we're finding out from science is that their brains were actually altered. And perhaps we believe we can heal that, but in the long term, but in the short term, their biology and their structure in their brain was actually changed in brain scans, so that they actually have, they lack skills, but they actually also lack the ability to emotionally regulate and to do a lot of things that a lot of people take for granted who didn't have a lot of adverse child experiences, and trauma. The reason we know that, the three fields of science that are exploding in this research I love it, because it's like we've been doing this stuff in counseling for years,
right?
And now what we're seeing with the research, and Scott Miller will be the first to probably say this, and others and Dan Siegel is, look it. Science is confirming what counseling already knew. Now we just have a scientific study backing it. And we've had scientific studies backing counseling, but now it's even more important. So neuroscience, the study of how brain supports mental processes. Developmental psychopathology, how adverse experiences and trauma and other things influence the growing mind and brain of a child, and they grow up to an adult, and how do they act, how do they behave, what goes on. Interpersonal neurobiology, which I believe Dan Siegel and a bunch of other medical doctors and psychologists and neuroscientists and counselors have been working on, the research on how our behavior influences the biology of those around us, and also the key to understanding our own behaviors and emotions, different things, through understanding our own mind and brain, which I love the interpersonal neurobiology stuff, but it is intense. So if you're wondering what that is, I would recommend the Pocket Guide to Interpersonal Neurobiology to start with.
Beautiful.
And that's even intense, because I bought a few other books, and I'll have to tell you, they're slow reads. But I wanted to just jump off there, because I know that this is your thing. So wherever you want to take it, I just wanted to introduce that for our listeners so they know what we're talking about.
Well, I appreciate that, Paul. It's wonderful. It's just remarkable. It's a really exciting time. The opportunity that I have to train in the community, whether it be foster parents or psychologists or psychiatrists or primary care physicians or medical students. I mean, my organization sends us out, our particular department. My full-time job, my main gig, is to travel throughout the community and help people understand these things. And you could argue that trauma-informed care has become a beautiful justification for what gets called integrated care, whole person care, complete care. And it's just wonderful, because it seems to have resulted in a number of ideas coming together. There's a beautiful confluence about ideas about the very things you were mentioning. How do human beings develop, right? What's happening to that person's nervous system? So it could be prenatal, it could be intrauterine, it can be in early life. We can be looking at infant mental health. We can be looking at primary care. You have all these people doing the research, and they're getting an idea as to what is it that's ultimately influencing that nervous system. So you could say that a common language is emerging that focuses, like you said, we're finding out that there's a beautiful scientific basis for these things that maybe professional helpers of many, or healers, helpers of many kinds, may consider to be, well, that's kind of commonsensical. That makes sense to me. There's a certain appeal to it, right? And now to have these data come in, this investigation, this research showing that justifies an integrated way of looking at people, this integrated way of treating the whole person, of helping the whole person, thinking about what helps that person grow up in an integrated way, well-connected internally, maximizing internal resources, reducing the influence of overwhelming experiences, taking into account relationship and attachment, taking into account how it shows up in the body. Like you mentioned, the adverse childhood experiences studies now have been done in 39 states and in 9 countries, and who knows how many thousands of people, maybe over 100,000 people, showing us the same kinds of things, the same kind of patterns, just like you mentioned. These health outcomes showing some sort of, as Nadine Burke-Harris describes beautifully in her TED Talk of 2014, just beautiful, that pediatrician out of the Bay Area, Nadine Burke-Harris, talks about. These health outcomes show up in a lot of different ways, right? Depending on what the person's exposure to those adverse childhood experiences are in the first 18 years of life. It speaks to so many beautiful things because it's like we say with integrated care, we're just talking about the nervous system and everything attached to it.
Right.
Like, what do you need? How much more do you need? We're just talking about the nervous system and everything attached to it. And there are these beautiful explanations, hypotheses and theories about how that human organism is developing. And then you realize, as Dan Siegel says so beautifully, right? The mind uses the brain to express itself, to grow itself. Or you'll hear Heideli Sauls out of Harvard say, it's biological. The nervous system is like a wire that grows itself based on the inputs it gets. Or you hear Jack Shonkoff out of Boston, out of Harvard, also saying things like, "No, this is not just bad behavior. This is the environment having a way of how the organism expresses itself." So it's just remarkable how we're seeing these things are all connected. There's a confluence that suggests a kind of a set of connections going on. It's like a metaphor for the nervous system itself and how it develops. How do things get expressed? So it gets us thinking about. People may say the word trauma is getting overused. Maybe we're calling everything traumatic. Well, that's traumatic. Well, what do we mean by traumatic? That gets in there, right? We're talking about stimulation, too much stimulation, too little stimulation. Is the person, living a life more like in solitary confinement, or does it look more like Blade Runner 2049, where there's all this stimulation happening? What is it affecting that organism's development anywhere? And then you get people like Brian Weiss, who talk about, who uses clinical hypnosis quite a bit, is famous for that, talking about, or Roger Wilker out of Scotland, what happens if in this safe environment, so it speaks to what kind of environments are going to help us know the most about how that organism is developed, how that organism shows up.
Yes.
Those guys are talking about, we let people get into a safe environment where there's no judgment. There's this fundamental, radical acceptance like Marcia Linehan talks about. And then look what happens. It gives us a chance to find out more and more, like Erickson might do. I want to find out more and more about your values and motivations, indications of your culture. I want to know how your organism has come together. I want to see and experience how it expresses itself in its totality with the attitude of, well, guess what? Let's build this therapeutic relationship where we're going to collaborate. We're going to utilize everything you show up with in this safe, non-judgmental environment. We're going to increase the chance that we make good use of your strengths and build on them. And we're not just going to focus on what you think about. And we're not just going to focus on what you feel. We're going to focus on how everything connected is expressing itself. We're going to focus on the body. We're going to take all of it into account.
I like that. I I love how you're just there's no papers in front of Randy. For everyone listening, that was all from his brain. So okay. I love all of that, and I just to kind of reflect. I'm just going to reflect a little bit because you said a lot, and I had a lot of ideas, but I'm really glad you said all of it. The body. You know Joseph Campbell.
Oh, sure.
Okay, so because I find myself not wanting to sit after sitting most of my day. So I've been listening to a lot of audiobooks, and so I've been listening to some Joseph Campbell books. And one of the things he was talking about from his study of early people, and myth and origin stories was about how we don't give our body enough credit. He said the body is a secondary organism. The brain is a secondary organism to the body because the body is the collection of the nervous system, which is exactly what you're talking about. So we, like you said, we're not just talking about the brain. We used to have this idea that everything flowed from up here in the brain, in the head area, but the mind is, I don't know if Dan Siegel, if I'm saying this correctly, but the mind is kind of like what we believe is sort of, facilitating the brain, which the brain is not just in your head, everyone. You have nervous system going all throughout your arms, all throughout your body, all throughout your legs and feet. In fact, this is I found this out from a recent article about this whole big thing they're having a revolution of the gut-brain connection.
Oh, it's lovely. Yeah.
So that 95% of your serotonin is made in your stomach and your gut.
Yeah.
It isn't in your brain.
Right.
So like, what are we even talking about?
Right.
So you're talking about this whole person care. It makes sense. And then to help people understand themselves, to understand, that, if we leave ourselves to our own ego and are trying to solve everything all the time in this sort of energy, we're not listening to our body. And our body is intelligent. It has intuition if we sit and we listen. And currently, not to go totally macro on us, but in our current United States that we're living in, things have gotten a little bit faster in the past 10 years, I think, actually.
I think it's very, yeah.
And people are a little bit more stressed. They're working more hours. We have worse health, all this sort of thing. And part of it is we have this insane speed we're living at.
No doubt about it.
And so how is that affecting the nervous system? But then how is that also not only affecting child development, but how is that also affecting our ability to listen to our intuition, which may be able to tell us things? And so for a client who's depressed, they can't hear their intuition. They're hearing all sorts of negative messages from, something recycling through their mind, maybe from a trauma, from a bad experience, or just, could be a number of things, low self-esteem, or like you said, the nervous system grows itself. So perhaps they're actually listening to a repetition of a negative thought that never was corrected. And now it's proliferating throughout the nervous system. And that's when people who feel depressed, they feel heavy. They feel like a wet blanket's on them. They feel like they can't get out of bed. And people are like, what's wrong with you? Well, it's because you're not experiencing depression. It's not just in their mind. It's in the body. They used to say it's all in your mind. It's not. It's all over your body. It's all there. So one of the things I found great about EMDR, which we discussed, and hypnosis even in some forms, and mindfulness-based stress reduction therapy, mindfulness-based cognitive therapy, is that we're getting in touch with the body and we're going back and forth between what we think, our thoughts that we hear, and our body, and then trying to listen for the body. And I've even done some stuff which we won't get into. I don't want people to freak people out, but or I'll have people ask their body, like the part of their body that feels weird. I'll have them ask it questions or imagine colors or imagine animals, and people are looking at me weird. And I said, listen, this is just an imagination experiment. This isn't voodoo. Just ask your body what it feels, and we do enough relaxation. They say, oh my gosh, well, it told me the answer. Well, it's you. It knew. You knew, but you were so stressed. You were so in a heightened sense of stress that you became, a dualistic thinker for a moment, and thought, I either need to solve this problem this way with brute force or this way by running away. And the problem wasn't solved by brute force, and it wasn't solved by running away. It was solved by listening and breaking down to a deeper layer. And for somebody the other week, I can't quote them, but this is a gist of what they said when we did this activity. They said, oh my gosh, I just needed to show love.
Oh, that's lovely.
And I was like, whoa. That's the purest.
That's outstanding.
Thing. And then this whole session, they're like, okay, you know what? I think we're done. I think the session's over a little early because I know what I need to do now.
Oh, lovely.
So that wasn't even EMDR. That was just, using a hybrid of stuff I learned from you and from the Ericksonian hypnosis and just a bunch of other things. So I've been babbling on about my reflection back to you, but integrating the body, and then how do we get you? I love this. You educate psychiatrists and doctors, because one of the big things we're having trouble with in this integrated system and trauma-informed care is how do we get the doctors on board whose training did not include this?
It's interesting, isn't it? One of the things we're finding is we're trying to appeal to them, as we Ericksonians learned, that if you want to increase the chance that people think, feel, sense, and or behave in new ways, you start with what's familiar. Would you believe, Paul, that oftentimes what we're finding is helping in those training events? Of course, we know in general, those of us who do training professionally with adults, whether we're designing training or facilitating training face-to-face or however we're doing it, there's a great need to validate. It's almost like it goes back to attachment theory. Human beings who don't feel validated, who don't feel safe, don't tend to explore new stuff. Now, we're asking these people, like physicians, for example, who are used to, for a lot of reasons, have habituated. They're used to carrying a lot of responsibility. They're used to perhaps the power, certain authority, autonomy to some degree that comes with doing that work. And it's asking them to go out of their comfort zone. So we're asking them to say, okay, we want you to collaborate more. We want to share information more than ever in an integrated environment. That means more than just cohabitating some sort of building or people having the access to the same electronic medical record. It means really sharing ideas with people in a collegial, collaborative way. In other words, that the relationship between primary care and their colleagues from other disciplines with other titles and other professions do this in such a way that kind of mimics the kind of relationship we think is ultimately going to be most empowering and reduce the influence of these adverse experiences we're talking about were the people who come for help. And so what we find is we validate a lot about what they know how to do. We normalize and respect their frustrations. And guess what we find out? They oftentimes describe that they don't feel. It's interesting because I'm going to talk about a felt belief.
Sure.
They can feel in their bodies a notion, they feel it in their gut, or their guts, I should say.
Sure.
Because they don't all have the same gut. I mean, I don't know, maybe they do in some interesting way. That they're not building relationships with people. That they feel like they've never felt more pressure than ever to produce, to see the maximum number of people, to get in, get them out, do the diagnosis. Even if they're not running across the ideas so much that they might get from their colleagues, like from Colin Ross out of Texas, who might say, like you were mentioning earlier, might go through the diagnostic manual or manuals and say, you know what, if that person didn't have these adverse childhood experiences, didn't have these things of violence and abuse and neglect and poverty and these symptoms show up and things show, substance use in the home to this extent, we might not see these things get expressed so much, these pathologies show up so much. They may not be aware of those things, but what they do say is that they lament that they don't believe they have an opportunity to build very deep relationships with people, that they're just there essentially to do some sort of assessment, satisfy somebody's idea of what productivity is, which is an interesting concept in and of itself, isn't
Sure.
it? and move on. And it gives them, they describe feeling a little disconnected. They describe feeling they're carrying all this burden of responsibility, but they may not have gotten an opportunity to share these ideas. So that's how we present it to them. Hey, look, there's this whole really cool thing out there. So now I will tell you, we're careful if we give training to primary care physicians, for example, about trauma-informed care. Make no mistake, all the people who are talking at them or whose things we're citing, Elizabeth Hudson, or it's going to be a Nadine Burke-Harris, or it's going to be a Bessel van der Kolk, or it's going to be a Dan Siegel. They're all going to be people who relate to them somehow. They're familiar, as we Ericksonian would say. Right. There's something familiar there for them, like family.
Well, and so Bessel van der Kolk was a psychiatrist,
right,
and an MD, and he's I don't know if he still practices in that way, right, but he's written books and lectured and whatnot. And then Dan Siegel is an MD, was a psychiatry at
UCLA, I think, right?
Yeah. And he's of course heading up immense amounts of research and collaboration in the interpersonal neurobiology. And I don't remember who the other two were that you said.
Well, Elizabeth Hudson is best known in Wisconsin for her work on trauma-informed care. So there are people like Elizabeth Hudson, Kathy Cave, Roger Fallett. All of them essentially have been saying for a long time now that this integrated way of looking at people just makes sense. It brings together what we know how to do, and it essentially says this living in silos with our expertise about how to help people is not optimal. And it's especially when we're faced with making the most with fewer resources, frankly.
Well, that's we're making the best of the fewer resources, and also the fact that, we won't go into a whole medical lecture, but nothing in your body's organs don't function in a vacuum.
Right.
And your nervous system doesn't function in a vacuum.
Nope.
And your stomach and your digestive system, and I'm not a doctor at all, but I know this, and that's why, we're trying to figure out how do things function together? How do things integrate? Because it's all connected. And obviously, if you break your leg, go to the emergency room, and you're going to have to get a specialist for that. But then, after that, where's is there integrated care? Is there physical therapy? Is there, for instance, if you were in a motor accident, is there a counselor there to help you with possible trauma symptoms? What are we doing for bone density?
Right.
What are we doing for pain? Are we loading you up with opiates, which we have a crisis right now?
Exactly.
Of opiate. Somebody goes in with something, gets 30 pills. They probably needed 12. I'm not the doctor, but I'm just saying,
Right.
like, where
Right.
where are we getting all these pills? What are we doing about pain? What kind of pain management programs are there? And so the cool thing is, in one way, we've got all these great ideas coming together and getting more and more momentum, and a lot of counselors are learning about it, and doctors are learning about it, and different disciplines. However, we still have this this other system, and I think I liked how you were the ways things always have been done, the rote system.
Right.
Even if it's not in the textbook, this is the way they're doing it at the hospital.
Right.
And so, how do we transform that? I like that you said we validate them. We're not trying to say we're in a war with you. We want to collaborate with you.
Exactly.
We want you to do your best medicine.
Absolutely.
We want you to be able to help people and not feel like you just are making sure somebody doesn't kill themselves, so just give them this drug.
Right.
And you're only going skin deep and you have 15 minutes. We want to help you to use your tools, because at times we're going to need a quick fix when people are in a real pickle.
Sure.
Especially people that have been traumatized. We need sometimes something to we need a bandage. We need something to help them so that the long-term therapies can take effect. And so then the other part about the brain is that the cool part we're learning in neurobiology and neuroscience is that the brain can generate new growth patterns.
Right.
It can have new ways of thinking in ways that we can't even fully comprehend yet. But for instance, one of the studies, there's multiple studies on this with mindfulness-based stress reduction. These students would do 25 minutes a day for about 90 days. And what they found is in the scans, there's more gray matter in their brains. And of course, that means your resilience to stress is higher.
Right.
So anyway, that's just my reflection, and I like how you're educating, and I wish more large behavioral health organizations in different states would adopt the learning model, because I feel not only is it the right thing to do, which I believe it is, because the science is saying this, and we're still using science from the 70s in a lot of clinics,
right? And
that was 40, how many years ago?
Good gosh, we're 50, talking 40 to 50 years ago, right?
And some of our hospitals and clinics are still using that science with maybe some new cool tools.
Right.
So where is we have all the science, why aren't we implementing it? I understand that that's a huge question that no one can answer in this room, and I have no idea what the answer is. But if we educate, we're saving people time.
Yes.
We're saving money.
Yes.
We can then focus on prevention.
Yes.
It just makes economic sense.
It really does. We're realizing now, one of the things that trauma-informed care, since Robert Onda and Vincent Felitti were doing their now famous studies, right, in 1997, 98 in Southern California, and we're realizing now that we're seeing how we don't do a whole lot of prevention. One of the statistics that's come out of Elizabeth Hudson's work and others who've done this at the federal level have been speaking about, they're estimating for every $100 we spend trying to solve problems once they're already problems, and who knows what we're measuring as problems. It's not to mention all kinds of huge systemic problems related to delivery of healthcare, inclusion, systematic institutionalized trauma, historical trauma. Who knows what the impact of those things are. Mm-hmm. Or the impacts of those things might be. It's remarkable. One of the notions that's come out, that's thrown about quite a bit, is for every $100 we spend trying to solve problems once they're problems, we're probably spending about $1 in prevention. Now, that runs counter to everything we know about good prevention, mm-hmm. right? So it's opening up all kinds of avenues and opening channels. You could say that on a societal level, there are opportunities to open channels, to be vulnerable, to be embracing. It speaks to cultural competency, about how to include people, how to help them get access, to do it in respectful ways, to really be still long enough to hear what matters to them. It speaks to so many ways of redesigning these ways of helping people, being more like a village, being more collaborative, being respectful, being inclusive, going beyond tolerance, and truly embracing people in all the diverse ways that they show up. it gives us an opportunity to do these things on a really big scale. Now, when we bring those things up in training, Paul, people will say, yikes, it just seems so big what you're talking about. You know, Laura Vandernoot-Lipsky in the Trauma Stewardship Initiative out of Seattle talks about, we're talking about the entire ecosystem here, people. I mean, her background was working in an emergency department in Seattle in Harborview Hospital, and she was watching people burn out. And it had her thinking about, how can I reduce the influence of what's happening to these people? You know, they're craving stopping their jobs and doing something a lot more simple. You know, they have craving. They go to Starbucks and get their coffee and they think, I think I'd rather be working at Starbucks. That would be a lot easier. My life would be a lot simpler. She makes an implication that, and she says it in different ways, she wants to help people remember why they're doing this. So you're talking about because it's the right thing. It really appeals to me. Because it's humane. Because, as Bruce Perry might say, we're trying to get the prefrontal cortex back online. You know, we're trying to keep it open for business, as Bruce Perry says so beautifully. And he focuses on how children develop. And he's talking about now, as it relates to how we educate children, as it relates to how we're going to foster their development. How are we going to help the caregivers take good care of them? How are we going to reduce the effect of things that may have happened to people for generations? How are we going to do it? And so he talks about when he does his beautiful assessment system, the neurosequential model for caregivers, for educators, for clinicians, he's always talking about how can we maximize that human nervous system so that everything connected to it starts to become aligned and people start reaching their potential. Look at the power of that. Well, we bring these things up in training, and I go on like this in training, right? And people go, it feels so big. It feels so big. Like, what can I possibly do? And then I say, what's the best predictor of good outcomes? The relationship. Go about the business of relating, of attuning, of honoring the wisdom of the body. Honor the wisdom of what you bring. Mind expresses in body. Mind expresses in brain. It's all getting expressed there. Be present. Tune in. Turn off the phone. Turn off the TV. You know, the 4 T's, like we'll tell with foster parents, but we're telling the clinicians, we're telling the helpers, right? You know, thank goodness. I had a mentor when I was in graduate school say, Randy, if we waited for the world's healers to get the right credentials, the planet would go to hell in the handbasket. Tune in. Be present. Those things that you hear all these folks talking about. Listen to the power of the body. Listen to the beliefs, the felt beliefs of people. You know, find out their truth. Be willing to listen to them. Anyway, blah, blah, blah.
Yeah, no,
same idea.
That. I like that because, well, there are systemic implications for how our entire society and planet functions together.
Right.
And that is a huge question that maybe can scare some people.
I think so.
And I think what it is, we're just starting with the relationship, and we're trying to honor you from where you're at.
Right.
We're going to meet you where you're at. It's like 101.
Yep.
And so that means that if you grew up in a certain place in the United States from a certain religion, that you're able to understand that that is where you grew up, and that's valid and amazing and wonderful and beautiful. And if you come into my office, I'm going to honor that. But when somebody comes into your office, then you must honor from them from where they're at, and see that as is this kind of what I'm saying? We're attuning to what's coming in,
right? Because
oftentimes in certain places, you can have all the right answers in the world for a client, but none of them are going to be valid unless you figure out what's important for them.
Right.
You can give all them information. Here's how you do sleep hygiene. Here's how you do exercise. Here's how you quit smoking. Here's how you regulate your emotions. Da 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 da. Okay, I need to have that relationship. I need to attune to you to figure out where's your leading edge? What do you want to change? And start with something small.
Right.
Because people don't want to be taken over. They want to have their autonomy. They want to feel, right. And so then you're talking about all this openness and attunement, and then how do we even, as a system, you're right, like people get into their careers, right? After all this school and all this student debt, we shouldn't even talk about that. And they go, what am I doing?
Right.
I would rather be at a taco truck selling tacos at the state fair or something. Like, I would be so happy, this stress and this responsibility and this pressure. And what you're saying is opening up. That's scary to people, Randy. And so I know when the people that might be listening are like, okay, I'm all about opening up and trying to get out of the way of my ego and listen to my body. But the ego is a dangerous tool if we don't realize that your thoughts, are just your thoughts.
Right.
I can't remember what's that quote. Your thoughts thoughts aren't always true. Our brain babbles on about everything all the time. I always tell, trying to normalize how the brain works. The brain's always chirping, unless we're like meditating in an ashram for days, whatever. But our brain's always chirping. I tell people, you go stand on a bridge, and you might have 45 to 100 thoughts in 2 minutes. Some of which are like, beautiful. Look at that beautiful highway under me.
Right.
And then, wait, what if I jumped off? Oh my gosh, what am I thinking about that? Or what if I push someone? Oh my gosh, that's terrible. We have all these, our brain is constantly assessing things, especially we're on a bridge. That's a little scary. It might bring our nervous system, but I don't know. Maybe you don't think those things on a bridge. I don't know, but everyone has these thoughts, and to normalize that our brains have these thoughts and recognize the difference between thoughts, feelings, beliefs, cultural context. We're just asking you to get to know yourself. And if you start to know yourself, you're going to be able to get to know others better.
There are a couple of things that come to mind as you say that, Paul. It's beautiful, that notion. It really speaks to the beauty, too, of us as helpers working on ourselves, resolving things, integrating things, fostering connections within ourselves, reducing the influence of where we had insecure attachments, where we had suffering, where we went through long periods of our most basic needs going unmet. To the extent that we might do that may increase the chance that we have look at all the metaphors we use, right? The wider window of tolerance. We do distress management or distress tolerance better. So many beautiful notions come out of that. As you were talking, a couple of pieces of wisdom that I got from a couple of mentors came to mind. One of them, well, actually, one wasn't a mentor at all. It was actually a person in a training who was very, very wise, very remarkable person. Had come to a number of trainings, like you did, we crossed paths in so many different ways, said the following to me one day. She said, I've kind of come to the conclusion at this place in my career. She had not been doing this work for very long. And she'd come to the following conclusion. It was beautiful. She said, I recognize I have a perfect human right to think whatever I think, and I have a perfect human right to feel whatever I feel. It could come in any form. Mm-hmm. And I have an infinite number of things I can do about those, including just observe them.
Right.
And I thought, wow, that's beautiful.
Yes. Well, I mean, that's I love that, because I always talk to people about your difference between response, reaction, and observation. But I think I stole that from mindfulness-based stress reduction.
That's lovely.
And so, I mean, I was taking that from the training manual. But you can't do that unless you're calm. It's hard to know the difference between response and reaction unless you've calmed down. But I wanted you to keep going, but I wanted to highlight that in a kind of a clinical way, because the last thing I'll say before I turn back over to you is, if you're out there and you're listening and this sounds scary to you, we're not asking you to change your belief system. No. We're not asking you to change where you grew up, what you believe, your truth, all of that. These are just, we're trying to learn more about the brain, the body, the nervous system, how we connect, what we experienced environmentally, socially, from if we had parents, what went on there, how that all impacted the way we express ourselves now. And in doing that, we want to help you learn the same thing.
Right.
So therefore, you just become the best version of yourself. That's what I was trying to say.
I love that. It was one of the things after the Erickson Foundation got through with us in the advanced training. After they'd given us all this stuff, all these stories about Erickson and all these demonstrations and these old films, and Erickson doing his magic and walking up and shaking someone's hand and a person's hand stays still, and he's doing all these miraculous things, right? It just is incredible. After they're done with us, 3 weeks of this training, and then when they're done with us, they say, okay, now, your task is to not be Erickson. It's to be the best version of you.
I love that.
Utilize your gifts. Find out your many intelligences. Awaken your creativity. Integrate. What is that notion from Ian McGilchrist, right? That idea of of course, we have all these metaphors and ways of describing, and oftentimes they're simplistic, but there is a kind of beauty to them. When I was a consultee for Ana Gomez, the a well-known, internationally famous expert on EMDR with children. I mean, she's remarkable.
Whose office we're sitting right next to.
Yeah, it's right. It's literally right outside this door and just a few steps down the hall. Anna, when I was her consultee in EMDR, she had me reading all kinds of people, and one of them was Ian McGilchrist, this neurologist out of Scotland. And his book, The Master and His Emissary, is just remarkable, where he's looking at world history and saying the societies who understood that the right brain, he said, I'm oversimplifying it, but to give us kind of a paradigm to work with, a structure, a platform, those societies that were right brain, recognize the right brain's the master. It creates for the love of creating. It just creates. It's art. It's just embodiment of art. And the left brain helps you put things in order. It applies syntax. It gives you categories. It gives you pigeonholes. It gives you a language and a sense. It gives you kind of a methodology to make things real. It helps you measure stuff. And he says any society that gets it backwards and thinks that we're here to count the grains of sand might lose track that there's an ocean right next to it. Right. We might lose the forest for the trees. Well, the reason that comes to me right now is that it reminds me that all these methods, Scott Miller's pretty open about, you think it's the approach, you think it's your platform, you think it's that. Really, while what you might take from it, if you think that the relationship, the attunement, the degree to which you in this beautiful, self-forgiving, self-honoring, self-actualizing, self-loving way model that prefrontal cortex, the so-called most human part of the brain, as Bruce Perry says, is open for business. It is now attuning and prioritizing and modeling, creating priority and creating a sense of managing your impulse and managing stressors, and gives you that distress tolerance and that beautiful window of tolerance, and helps you mitigate hyperarousal and dissociation, helps you concentrate, helps you tune into other people and have compassion. As you're doing all that beautiful stuff, sounds like a long list of things to master.
Love it.
As you do all that stuff, then you create this relationship that has this quality that maybe the person seeking help has not gotten enough of in these days when we're all experiencing future shock. Things are, like Alvin Toffler predicted in 1970 with future shock. Our rate of change would accelerate so much. When are we making that connection? When are we attuning to human beings? When are we co-creating and resonating in such a way that we can create stuff and model both of those things that we're creating, and that is what we're about. We're creating relationship. We're creating things together. We need the power to put things in order and to make things real and to create a syntax and a language and a methodology and a platform. Yes, that may be part of creating a sense of safety. To think that that's all we're doing, though, and we're not allowing for creation, exploration, an opportunity for people to go out and get stimulated or express their sense of mission in the world. So I think about perhaps one of the greatest things we do in that relationship building is modeling the idea that we're here to create, or we're here to express from a place of love, or we're here to remember who we really are. And so while those things sound, I guess, very philosophical, maybe very abstract, I get reminded that what that looks like is, I can see it when I see practitioners getting to that place where they're remembering that beautiful quality of being present. And sure, they're thinking about what they're going to do next, or they're thinking about what things what they are, being strategic, thinking about why they're doing what they're doing,
right? Being
intentional, modeling that, and at the same time, perhaps not being too rigid or chaotic, as Dan Siegel would say.
Right.
Managing to strike all these beautiful balances and to integrate here. Well, we're using that term a lot, aren't we?
Sure.
Bringing all these elements together for that to manifest in the relationship building,
which allows the people to. What would you say? We did all that. We're doing that. We're trying to help them do that, and then they could. What is this? Where do we go? The healing, expressing, living to their highest. Where do you feel like it's going?
I think all those apply, and I think also about them remembering who they are at the core, who they are. Some people will some of my clients will describe it as, I think I remember what my soul is. They'll say cool things like that, or they'll say, I feel more, not only more connected with other people, but I have a sense of what I'm really supposed to be doing. Or this is about being, and maybe less of a human doing. I'm more about being. Now, they describe it in a lot of ways. For example, like if the therapy's gone really well, like if I'm using EMDR, for example.
Sure.
And say if it's gone really, really well, like I've been working with one person. Oh God, all the folks I work with just have remarkably painful things happen to them where their caregivers growing up weren't really available because they were easily getting triggered. They were dissociating all over the place. They were over and under reacting, as we describe in so many ways. And they had experiences like, of course, and they had these other adverse childhood experiences, right? Like we've been talking about. And these things can start very early. They can start very early in life, and they'll have a sense that they started before then. And what I notice, I see a pattern, is they'll describe things as, my senses are more clear. I see colors more vividly. I hear sounds more vividly. I smell more vividly with more nuance and more shades of gray and other colors. I taste more clearly. I feel clarity. I feel time differently. I'm not waiting for the other shoe to drop. I seem to be more accepting. I think I deserve to. So it shows up in their cognitions. Yes. It shows up in their bodies. They notice that they're feeling their bodies, and it produces a lot of inconvenient truths. Like they become aware. I haven't been eating well.
Right.
I haven't. Why am I putting up with these relationships?
Oh, yeah.
Why have I been doing this job so long? Why, you know what? I realized the other day, why am I even listening to that music? I don't really like it. And where did I get that from? Why am I hold a second, I've been living in this neighborhood all this time and I never liked it. So they have all this beautiful clarity.
Yes.
It's wonderful.
Yes.
And then they get to this place of, and of course we hope to see it in all these different methodologies of them having thoughts, expressing thoughts like, I did the best I could. I always did.
Yeah.
Or it wasn't my fault.
Right.
I was just a kid.
Right.
It shows up in a lot of ways.
Oh, I love it. I love all of that. I love how you explained that. I've got so many ideas because you mentioned the soul. And so then there is a loaded word depending on where people are from. But we'll just use that word for context, which is, well, not context, but we'll just use it for a placeholder, whatever you want to call it, because that could be our belief system about why we got into this, and that we feel this deeper connection. And so that reminds me of the Jungian, which we haven't mentioned, but
it's beautiful.
Notion of holding on to the opposites.
Right.
That life is both difficult and beautiful.
Right.
And that we've all experienced times of rigidity and times of chaos.
Yeah.
And we've experienced it as a culture, and we've experienced it personally. And how do we live in the tension of the opposites, of the difficulties?
Yeah.
And also, especially for people going through trauma, they might have their worldview might have been shaped to only believe that things are pain. Cynicism is normal.
Right.
Everything's about money. Everything's about some sort of abuse. Everything's about how you look. Everything's about what you can buy or attain, or everything's about just terrible, awful poverty and war. And so we're trying to help them find out remember who they are, and that sense. I think sometimes it's like an innocence, or I'm not trying to say innocence because that's loaded too, but just like when you're a kid and you're just like feeling that carefree feeling, running around, you don't have any bills to pay.
Right.
No one at school has bullied you yet. Maybe some of us experience that for 5 minutes of our life, somewhere around age 5 before you go to preschool, and some kid hits you in the nose and calls you a name because they saw their dad doing it. That beautiful exuberance, or that time you walk to you walk to some nature thing like a lake or a river or a stream, or you walked into the desert, or you walked to Circle K here in Phoenix, and it was just the best time with your friends. That beautiful feeling of being alive.
Yeah.
And it's okay. And why are we striving so hard?
Right.
In the end, we're all facing the same difficulties.
Yeah.
And so can we what's that quote that says, be kind, everyone you know is fighting a hard battle.
Right. And
just embracing that we're all human. We're all part of this weird system, this mystery that we show up in, and that everyone's got their opinions and trying to figure it out, and people are pulling out their hair trying to figure it out, and some people are sure they've got it figured out, and that's fine.
Right.
That's fine. But how do I live? How do I live while I'm here?
Right.
How do I exist? And I'm hoping people are getting the sense that we not only have tools that are just, EMDR is just getting started. There might be something else that shows up. Somatic experiencing. That's integrating beautiful. All of the therapies we've learned, integrating, cognitive behavioral, integrating mindfulness, integrating
Absolutely.
the mind-body therapies, integrating with doctors, integrating with different practitioners.
Absolutely.
But learning from this, you're right, we should stop calling it trauma, but trauma-informed or just, nervous system-informed,
right.
How the brain works, interpersonal neurobiology, and teaching people there is hope. You can change. You can alter how your brain is structured.
Absolutely.
Even people with traumatic brain injuries can do this. Now they might need more supports. They might need an environment around them. We all need an environment around us. We all need helpers around us. We all need a community of some type. And that there is a way to feel free again. So sometimes I've had clients say that to me, like, "Oh my gosh, I feel like this burden
right
I've been carrying."
Yeah.
It's just gone, and I don't, you're right, like, everything's just different. And so there's the funny part. I call it the healing crisis.
Right.
You heard of it? I don't
absolutely.
know if I'm using that word right.
I love it.
The healing crisis is when somebody comes into therapy, and they're like, this is the problem. This is the problem. So I work with them for a while, and all of a sudden they're like, wait a minute. I don't even care about that's not the problem.
Right.
Now I've discovered this is the problem.
Right.
This is like 7 layers deep.
Right.
Doggone it. Why did you show me that? I was like, I just was helping you, guiding you along. I didn't know that would come about. And then now I've got to make a big decision. But when they make that big decision, when they had the courage to make that big decision that
right.
they knew years ago maybe they should have made, or
right.
I should have said should, never should on yourself. Sorry. But they wish they would have made that decision years ago.
Right.
But when they finally make that decision, the freedom,
yes,
and this transcends all of these silly, ridiculous arguments we're getting into as people these days in our country and on social media. It just transcends it all.
I think so too.
And to just be able to look into somebody's eyes and be like, you know what? I know we disagree about whatever stupid law that we're arguing about, but I like you as a person, and I think that's good that you have that opinion.
I think it's beautiful. I couldn't agree with you more. Long before I ever got interested in Erickson's work, or got interested in EMDR for that matter, I was really influenced a lot by the ideas of Irvin Yalom and the idea of finding these universal curative, he called them curative or therapeutic elements. Mm-hmm. But there's beautifully as existential of this notion of, you get a group of people together and you get them safe enough. You get them to where their typical interpersonal patterns, their beliefs, their motivations, how they perceive the world, the filters through which they see the world, they experience it, come to the surface and give us an opportunity to have some influence on, together in a collaborative, creative way, get to this beautiful place that, again, a student brought up in a cultural competency class I was facilitating, said this beautiful thing about that, who said, and it was interesting because she was actually I think I may have told this story in other classes. You may have heard it before, but essentially saying something to the effect of, I'm not gonna treat anyone the same way. We're all unique manifestations of all these things. Teach me how to best help you, so the next time I meet someone like you, who reminds me of you, I won't do it the same way. It was a person from a similar vein who said this in a cultural competency class. That reference there was actually to an assessment class of all things. Oh, okay. But this came from a cultural competency class, maybe just a few years ago, maybe 3 or 4 years ago. I was terribly moved by this. She said, I think I will meditate on this. She said it in the middle of class. I thought she was asking a question. Mm-hmm. Said, I think I'll meditate on this. May we all embrace our differences as we tune into what we have in common.
Oh.
May we discover what we have in common. And I went, hold it, would you say that again?
I want you to say it again right now.
I thought it was just wonderful. Now, see, it's funny. This is what happens, right? This is what happens. Our clients teach us how to be therapists. The participants in the classes teach us how to do all kind of things, to be better teachers, I guess, or facilitators, or whatever it is the word we're doing. Said, may we embrace our differences as we discover what we have in common.
Oh my gosh, that is just profound. I think that should be on bumper stickers. Maybe she's got but I mean, it's beautiful. I love it. And that is, that hits just so deep. It's so many layers deep, and it dissolves so much unnecessary squabbling, and just it brings life into. Is this life an adventure and discovery and creativity And despite the difficulties and suffering involved in living in a human body, just this gorgeous transcendent experience. And if we got to train our brains, because it's not always a choice. Sometimes depression takes over, but over time, can we learn to live in a way, and maybe it's our unique way, where we learn some things so we can integrate our own minds and our own practices, so we go about being an example of that.
I think it's where we may have the greatest power, is by demonstrating as an example in the many ways that we can do it. And I get reminded, Paul, all the time. And frankly, it brings me joy. I think it's the one reason why I keep, even though I get so busy and I'm trying to do so many things, and I'm training, and I'm getting involved in so many projects, and a design training and self-directed training, online training, I'm doing all kinds of things. As to why I keep doing psychotherapy is, and I just get reminded how beautifully joyful it can be to watch people reclaim themselves, to forgive themselves, to discover that child again, and to get into those states of being like they were when they were just going about the business of being and creating, and the 50th time you do something is as fun as the first. And I find that when we do therapy with children, and I see it with EMDR, but no doubt it's going to be true with somatic experiencing, I don't know, thought-field therapy, brain spotting, whatever you're doing. One of the things I see with children, and I know Anna's talked a lot about it, and folks who primarily would work with children would typically tell me in training, it's so fun because we do these things, we focus on the relationship, we open up the multiple channels for them to express their truths, so we're flexible, we model that beautiful balance of both providing safety and promoting their discoveries. I mean, like we ought to do with anyone with a nervous system, as we say, right? This only applies to those with a nervous system.
Right.
And yet what they say is, it's just remarkable. It doesn't take a whole lot to reduce the effect of the suffering they've had, so the world goes back to being this fascinating, safe, and a curious and remarkable place, this miraculous, wondrous place again. With adults, there's this interesting crisis. As we go around the business of reducing the influence of all that suffering or their adverse experiences, there's that beautiful notion. Sometimes my clients describe it. They dream about it. They'll say, I'll have this experience like I'm tearing off. It's kind of like Invasion of the Body Snatchers or something. Like they have this crusty exterior that's not really who they are, that they're tearing off, actually very painfully, dismantling, tearing off, breaking down, cracking. It's falling around.
Like a metaphor of a metamorphosis coming out of a scaly body into a new body. Keep going. I just wanted to give that picture to the listener.
Yeah, I love it. Thank you. Yeah, this metamorphosis of losing these exterior bodies, these shells, armor, if you like, that in some degrees protected them from the world of discovering that vulnerability, right? Brene Brown talks about that beautiful vulnerability. Well, they've never known it. They're not habituated to that. And the notion that they've constructed unconsciously in many different ways, I know there's so many hypotheses as to how that happens. You could argue that they never were maladaptive. They adapted beautifully to systems that helped them create these scaly, crusty bodies on the exterior that are falling away, so they're having these dreams of them falling off. And then comes the multiple crises of, well, like I said earlier, the inconvenient truth. Like, well, hold a second, I don't know who I am. Who am I?
Right.
I'm feeling, hold a second, why don't I feel anxious? Hold a second, why do I have more energy? What does it mean to my relationships or my job or my life that I'm not who I thought I was? And I didn't, and my addictions don't work as well as they used to. And now I'm more aware of how much pain that I lived with, and when I put,
like all of a sudden, I didn't realize my body was aching. Somebody said that
exactly.
to me. Somebody said, oh my gosh, I didn't realize that my whole back was hurting this whole time. I didn't even realize that until the other week.
Right.
And all of a sudden I'm like, oh my gosh, I need to stretch. Keep going.
Yeah, exactly that, right? And it can be a remarkable period of disorientation for adults, right? Even the way that they're used to describing themselves, the beliefs they have, the so many things that they believe. There's no limit to it. So all these things are falling off. They're discovering who they really are. Their senses are getting more acute. They're experiencing time differently. They experience their bodies very differently. And this presents a kind of a funny little crisis. Not funny, maybe not little and not funny.
Right.
But it presents a real problem where the children just go back to being curious and fascinated.
Sure.
And we actually give them, by doing these therapies, we find, contrary to popular belief, we find that when we do them well, we actually are providing them with a certain kind of inoculation or kind of protective factors. We're maximizing their internal resources. We're sending, and frankly, I mean, you and I both know, we're oftentimes, they're going back to some pretty difficult situations, with their families. And I know there's a common belief that maybe we're sending them back in with not enough protective factors. We're not really perhaps influencing very much the matrix, whether they're in an at-home placement, living with foster parents, about to be adopted, or back into a home where there are potential for adverse experiences. I know there's a lot of concern about that. I will tell you that one of the inconvenient truths maybe coming out of all this work that we're doing in so many different ways and so many different levels, it's leading to, I think, a greater awareness that we are. I think about those things that Dan Siegel and Jack Kornfield talk about. Like, why are we rushing to go to all these things? We're living very hurried lives. We're trying to make more with less. It's like we're in a race to have more experiences. That's one factor. And we're also realizing the degree to which we really are struggling to live as communities. We are really struggling to be there for each other, to be helpful for each other, to really live more like in a village. And people are describing feeling disconnected. So I think those are inconvenient truths. And like Laura Vandenhout-Lipsky talks about, our planet is showing us signs of it. Like, is this sustainable for us to continue living like this, being short-sighted, not seeing the bigger picture, denying the effects on the planet as itself as if we're an organism? Is this sustainable, the way we're living? We're living very much like we're in a crisis mode and like a chronic post-traumatic kind of response to things where we kind of overreact, underreact, we're kind of dissociating, kind of asleep. So anyway, the point of all that before I started babbling about all of that is...
I liked all of that. I keep going.
It is fascinating, right? Is what kind of societies are we making?
What kind of society do we want to live in?
Right.
What kind of society are we leaving our kids?
Right.
So a big thing is one of the reasons I was going to say I think we do this work is because while we might not be able to change the matrices of what's going on in that person's personal life in their school, if we help these kids heal, they may be able to change the matrix much more powerfully than we can from our therapist couch. So, but one of the things Hillman talks about, and I don't want to misquote Hillman, but he said something about what I'm discovering is that there is not a big difference between who's coming into my office presenting with all these maladies and all these quote unquote problems in their life and the society itself. They're sort of blending together. What I'm wondering is how do we take, not just one by one helping everybody, and that's a good idea, and educating other systems and medical and helping us have this new paradigm to help people heal and be their best self, but also how do we help the society heal from some of the almost psychopathology going on in the greater society and in the world?
Absolutely.
Are we looking at the long view? Are we planting trees that the elders of the society will never know the shade of, but the children will? That's a Greek proverb. I misquoted, and so it goes there, and then that is, I feel like then I think some folks who haven't done some work or on themselves in any way, I don't care what way they do it, they throw the brakes on right there and say, "What are you guys talking about? You're undermining our economic model, and now you sound like a bunch of whatever label they want to throw on us." But really what we're discussing is psychology doesn't want control.
Right.
We're over that. That's like ego level 1 or something.
Right.
I don't know. We don't want control. What we want is to be able to have people live a life where they're able to be happy and healthy in whatever way they define that. Yeah. And to be able to, not even happy, it's just how about content?
Yeah.
And minimize violence and destruction in our communities, and minimize alcohol and drug abuse, which can cause so many problems, and minimize the suffering. We're already suffering anyway.
Exactly.
But can we minimize the suffering? And part of that we have to question is how we're living from a systemic way. So in our way, you're right. We're changing one person, trying to help one person at a time, or for you, one hospital system at a time. And that's where it starts. Because if the individual changes, and then collectively we say, wait, we do have a lot in common. what? Hey, let's all, I don't know, I'm just making jokes, but like just
I
for fun.
love it.
Hey, America, let's reduce our work week to 32 hours because most of the studies say after about 32 hours, most workers are just checking out and checking Facebook. You know, like,
There you go.
I don't, you know, the studies of productivity.
Right.
And so why are we working so hard? And we don't have time to enjoy our life till we retire and get our golf clubs out. And then I'm so sick, my body hurts.
Exactly.
I'm retired. You know, so I know these are big questions that we don't have the answer to, but I think I think we do have the answer. It does start with, how are we taking care of this body?
I think so.
How are we taking care of this nervous system?
Right.
How is my nervous system affecting those around me? And I know I've made mistakes. I made mistakes as a therapist. I made mistakes as a person.
Absolutely.
Where I hurt people and I caused pain and I regret it. But that was part of my learning experience. And now, you know, reversing that in this role, how can I minimize pain? How can I influence the community in a way, in the individual and the family system, but also the larger picture?
I love the way you describe it, Paul, and I get reminded, for example, because I get that question. For example, if we're facilitating training for foster parents, it's kind of interesting. We'll be working with foster, adoptive, and kinship folks. If folks are considering adoption or maybe extended family who are taking care of these children who, for whatever reason, are not living with their biological parents. And they'll ask questions. They'll say, you're talking about all kinds of things. Tell me something I can really use, something I can take home tonight, something I can do with these children, because the children are easily triggered, so they over or underreact. They may have all kinds of diagnoses and developmental disability diagnoses and all kinds of things.
And for just layman's terms, they may be throwing the remote control at your television, screaming, yelling, or laying in bed refusing to get out.
Exactly.
Keep going. Yeah.
Yeah, exactly. I mean, they're doing all kinds of things, right? And so they're looking for some strategies and techniques to have a better influence on how those kids develop. But they just simply want life to be less stressful for them, the kids. You know, I mean, it manifests in a lot of ways. And they ask questions and complain and do all kinds of things, right? They come and vent. They offer each other support. There are beautiful things happening in these classes. But they'll ask things like that, like you're mentioning all kind of things, Randy or Jerry Springer or whatever your name is, because I look like the son of Jerry Springer and David Letterman, right?
I wasn't going to mention that because I didn't want to embarrass you, but when I first met Randy, I did think he might have been Jerry Springer's brother. And we will have a photo on the blog post on healthforlifegr.com with us posing. And you can decide.
Fair enough.
Yeah.
And so I tell people I'm the son of Jerry Springer and David Letterman.
Oh, that's right. That's how you.
Yeah,
you
that's one of them. I do that a few times, right?
I forgot about that.
And so they'll ask me these questions, right? They'll say, well, Springer or whatever your name was, what can I use? And I'll say, well, would you believe that I think the best single thing you could do is to model the following, that where there is self-love, everything else falls in place. That you might best model that in how you treat your body and how you talk about yourself and how you meditate and get mindful and eat well and exercise and get plenty of rest with what little time you have and the choices you make. And if you're having difficulty managing your impulses and you're noticing that you're having difficulty taking good care of your body and getting exercise and getting enough rest and spending a little time. Dan Siegel talks about that platter of good health, right? Doing these things of
the healthy mind platter.
The healthy mind platter, right? To the extent that you're having trouble with these things, then maybe you go and see somebody who can help reduce the influence of those things that may have happened to you. Because they find out oftentimes that one of the reasons they're showing up at this class, Paul, is they're getting their buttons pressed. They're getting their own buttons pressed, right? About working with these children or being a parental figure for these children who've had these adverse experiences.
Right. And for parents out there that I have lots of techniques and there's books, when I work with parents about things you can do and blah, blah, blah. But one of the things I say to people is if you take time for yourself, time out, which is one of the things from the Healthy Mind Platter, just take a little time out. And I gave someone the assignment. I gave someone the assignment recently they had to do 2 hours of something completely unproductive. And they looked at me and they said, I don't like that. And I said, okay, I go, how about 1 hour? They go, maybe. Because I make jokes. When I make assignments, they're never real assignments. I just say, if I gave you an assignment, what would you say? I'd say, I hate that idea. I say, okay, then you have no assignment. Wait, what are you going to tell me? Well, I don't want to give you an assignment. I don't want to tell you what to do. It's my little fun little game I play. But anyway, they did it, and they did their assignment, and I gave them an A+, and they said, I felt so good. And especially when you're a parent, I say to parents, have you taken any time for yourself at all?
Right.
Because if you take time for yourself to love yourself and you forgive yourself, your child is a sponge. Children are products of their environment. I mean, yeah, nature, nurture, blah, blah, blah. But it's a lot nurture. There's a lot of nurture going on. And they might have a genetic propensity for something, but, epigenetics is telling us that it doesn't get switched on unless certain elements are in play, which we still don't know what those elements are.
Exactly.
But perhaps one of the elements could be you. So let's not make it you.
Right.
Let's make you the person they want to be like, not just because you're their parent, but because of the way you live. And something popped into my mind. I have to say this. So parents, if you just take a little bit of time, I'm talking 1 or 2 hours a week. I know you might be working 2 jobs, but just do something for yourself that you love. Your week is gonna be so much better with your kid. And just they're gonna respond to how you're being in the world, how you're expressing your nervous system, how you're expressing your emotions. But one thing I want to remind you is, you don't even, like you said, you don't even have to be a clinician to be doing this.
No.
I mean, how many of us in our life know somebody? I mean, maybe they're at Trader Joe's, maybe they're a hairstylist, maybe they're a janitor at your high school that just embodied this loving, non-judgmental,
right.
no ego in the game.
Right.
Maybe they had a sense of humor. Maybe they didn't. They saw you for who you were. And we love them and we'll never forget them. I mean, I know you've got somebody in your life like that. And I've got, some people
absolutely.
in my life, but just
so many.
You know them when you meet them. They're
right.
living it. And they are just, they don't, maybe they were a therapist. Great. But these are just people in our lives and people always remember that person. Yeah. And so when we can get out of our own way and just
right.
try to be loving and accepting to others, no matter what they're going through, you can change people's lives. I mean, I remember a bus driver when I was 19, and he told me, and he was, I don't even know if he has high school diploma. And he said to me, I think he was of Mexican descent. We were in Texas, and he said to me, life is the greatest teacher. And I always remember that. And he was like so nice to me. He talked to me for like 3 hours because I was on this long, what was it? One of those Greyhound bus rides.
Right.
And I was kind of nervous. And so I sat at the front. Anyway, he told me about his whole life. And I don't remember his whole life, but I just remember he said that to me. And he was really nice. But anyway, we're getting close to the end here. I want to give you a chance to kind of take it for the slam dunk.
Sure, absolutely. Well, I appreciate that, Paul. I get reminded to the extent, like whenever we have these training sessions, and I bring that to the training with EMDR when we have an opportunity to show the structure of EMDR, right, or whether we're doing a consultation, I get reminded, no matter how we're doing it, with one relationship at a time, maybe with multiple relationships at the same time, to do this thing like you're talking about with the bus driver, or different folks I've known who've had a huge influence on me as well. It is by that kind of loving kindness, that risk of being vulnerable. Now, that's not to say that we're going to become symbiotic,
No.
But by the same token, I get it. It got described to me this way, and frankly, I don't even remember who told me this. Like so many things, right?
Mm-hmm.
I don't even remember who told me this, but the person was actually showing me. I don't even remember, where was I when this person showed me this? Well, boy, that's really helpful reference. Thank you, Randy. But the way it worked was, this guy was showing me, he said, yeah, we're not the same person, but we do come from the same source. And so he was showing me, like, if you throw like a Cheerio in a bowl of milk, or a pebble in a pond, an emanation, the splash comes out, right? Yes. And the drops come out, and the drops all come from the same origin, and each drop is not the same as the other drop, but they came from the same source. And in some times, you can see they're still connected to the same source. So in a way, they are the same, but they have manifested as separate drops. And I said, wow, that is beautiful. He said, well, we're made of the same stuff, and we each have a unique path. And each one's perfect. And I thought, and that stuck with me. Now, it's funny that I don't remember where I was or who the person who was that told me, like, how is it that I'm seeing this? I think it was a support group of some kind, maybe, where I had visited as kind of an observer or something, and he just got this idea to just show me this. He said, "I need to tell you this." I went, "Oh, okay." I think it was like 25 or so. I was still studying linguistics, and that's who knows all the influences that came together to teach me that what we're doing in the helping professions, and no matter what our title is, I get reminded we're a bit like Erickson that way. It seems like we're magicians. And I love it when I tell the trainees, or the foster parents or whoever it is with whom we're having these experiences. I find the best classes I facilitate, I get the sense that I'm not really directing anything. I just seem to be kind of, I don't know, facilitating some sort of thing. We're always just kind of there creating something together. I think it seems to go the best when I take that attitude. I'm kind of the facilitator. I'm the facilitator.
Right, when you don't take the control.
Right.
You give up the control, but you do have some ideas of what you might want to relay.
I love the way you say that, and that's one of the lessons I took from the Ericksonians, is the notion in itself, it's an embedded command. It's a form of suggestion. You can relax the expectation for control to gain power, to gain influence. Mm-hmm. Would you settle for power? Well, yeah, I'll settle for power. That notion that less can be more, or that you do it by your modeling.
Right.
I love the notion in those training situations. We call them training, but there's really something else going. All kinds of other things are happening, right? Human beings are getting together and exchanging ideas, right? And we're exposing each other to just this beauty of creating things together. I love those experiences, and I get reminded that what's happening there is we're practicing our magic. I find that I do better therapy, just to call it something, when I let that happen.
I love it. Yes. No, you can keep going. I was just agreeing.
Okay.
I was saying that, one of the things I'm actually doing a presentation on Wednesday called The Intentional Clinician, also the name of this podcast, 6 hours of continuing education, downtown Phoenix here, for a large behavioral health organization. And one of the things I developed from that was what I was trying to learn what I was trying to implement in my own practice. So I took stuff from Miller. I've taken stuff from Scott Miller. I've taken stuff from Jack Cornfield. I've, melded all these sort of teachings together, because one of the things I found that helped me the most was if I had in the morning, I remembered, I'm not in control. I'm not in control. It's not my agenda. It's not my agenda. Because, you always want a framework. So I'll say, hey, if you want to do EMDR in this next week, we can try that. But if I stick to that and I'm rigid, the person's going to resist that.
Right.
I've got to bring in what do you need? What do you want? And often it's something completely different than what I thought we might be covering.
Right.
And that is the best therapy. And I found other days, maybe, I don't know, unconsciously I was stressed or something, and I tried to implement and teach him something, or I don't know, do some exercise. Maybe they weren't feeling it. Those are the worst sessions I've had of therapy, or whatever you want to call it, where I was like, what do you, I'll catch myself. What do you want to work on? And I know we all have missed, therapies in art and science blended. So,
I get reminded, yeah.
But finding out what's important to the client is most important, and it always boggles my mind. So I make a joke with, I made a joke with a client the other week about how, my brain will still assume things. Right. And I'll still assume in my brain, I won't listen to it very loudly. It's turned down. It's like AM radio. But it'll say something like, well, if they could just figure out this, then this would help them with this, and this would help them with that. That's my solution brain going on. Right. And I go,
making those connections.
And let me just tell you, because he was, I was trying to level with him, say, I'm on your team. I said, guess what? I'm wrong 99.9% of the time. And he laughs. He laughed really hard. And I said, well, it's true. So I still make my assumptions, but I never know what's going to put the puzzle together for that person. I'm just trying to provide the guidance from what I've learned, and also just listen and not impose my belief system. And so when I can do that, and then I'm in the flow, and then I'm honoring that person, and I'm not stepping on their autonomy, or not, but I always, for motivation and everything, always ask permission.
Right.
Would it be okay with you if I taught you a few skills for coping?
Right. I love that.
No. Okay.
There you go.
But see, the beginner therapist, hey, I've got some skills for coping. Maybe they don't want that.
That's something. Two things come up about that, and that's one of the beautiful things I'm getting from Bruce Perry, who's training us in Arizona to work with foster parents using the neurosequential model. And Bruce Perry himself, I think, is a beautiful example of this balance of not letting his ego get in the way. I find him surprisingly approachable for a person who's accomplished so much, right? As a psychiatrist and a psychologist, it's remarkable. And so there's something about that dance that we do, and he models it really well. But one of the things I'm taking from him, besides that, just watching how he shows up as a person, is this beautiful quality of being willing to be strategic and to be intentional and think about, okay, now this is what, based on what I've gathered from this person's along the way, and always adding new data about how I'm experiencing this person and what seems to matter to this person, and how that evolves in our time together, because there's so many moving parts. It's so beautifully dynamic. To be willing to have a framework, like a starting point, but I need not be overly attached to it. I don't have to be rigid about it. I don't have to be chaotic. I can model all these things. I can be flexible. I can provide a sense of safety for me and the person. There's all that fun stuff going on, and there's also that beautiful quality about being willing to change it along the way, to do that, and always taking into account whatever it is that the person, like you said, so beautifully, is being willing to do that. The Ericksonians had a way to exercise this. Parenthetically, I will tell all of you, if you ever get a chance, Paul, you mentioned it earlier with the Erickson Foundation, all those conferences they do, the couples and the brief, solution-focused stuff, the evolution of psychotherapy, you get to see all these people, right, and all these other practitioners and healers of many traditions coming together. Their intensive trainings happen several times during the year, and they're typically here in Phoenix. Well, one of the things that they do so well in that training is that they give you a little bit conceptually, kind of show you some concepts, show you some demonstrations, and then it has this beautiful quality of you practicing things with these other folks who come from all over the planet, to learn about these methods, right? Clinical hypnosis, but a lot of other things get thrown in there. One exercise they do that's so beautiful is that they would have us while we're practicing with our colleagues, we might come up with, okay, based on our interview of a colleague, what the person at any given time wants to focus on, whatever it is the person wants to work on. And so then we're given the assignment of writing this script as to what we're going to say and what we're going to do, like Erickson might. So with a lot of, we're going to write this script and exactly what we're going to say and how we're going to say it, and the tone of our voices, right, and what we're going to do non-verbally and all that fun stuff. We're going to write all that out, right? Right. And then they have us practice. And then we find out oftentimes, like you said beautifully, we're still kind of missing something. Our attunement's not real good. It's like we tried to base the script on our assessment of what's going on with the person, and yet we don't seem to be quite connected, and what we're offering in the script doesn't seem to quite resonate for the person and quite fit very well. Okay, so then there's a piece of, okay, now let's, based on the feedback you got, go refining your script. And we keep finding out that it's just an approximation, right? And so Dan Short, for example, wrote this book about strategy of partitioning, strategy of progression, hope and resiliency, beautiful book, of how you might think strategically about what you're doing. And then they did something really cool, Paul. Then they said, okay, we'd like you to ad-lib it. Just ad-lib it. You're assessing what's going on with the person, and you're just going to, tune into...
Improv.
You're going to, it's going to be all improvisation. Mm-hmm. You're just going to improvise. And we find that, okay, so sometimes that doesn't match either. And then they had us look at the quality, the nature of how we were improvising. Okay, so what is it that, take a look, write down what you came up for you as you were improvising. What was fascinating is we found out in this rather experiential way, because experience, is such experience, life's a great teacher, right? Here's what we found out. If you go with a script, you're going to wind up making nuances, you're going to wind up adding nuances to that platform, that approach, whatever that is, you're gonna add nuance to it to better fit the person. And guess what? If you ad lib, you're gonna create a script. That's how they did it.
Talk about the opposites. Yes, I love that. It's funny because in the training, people do the PowerPoints, and I used to be very rigid because I was afraid I wasn't going to get the information across. And then I wrote this whole script. I don't know how many pages it is. It must be 41 pages for my training. Yeah. And now I don't read the script. I never did. But it was for me and my nervous system, because I was anxious about presenting the information and making sure they got the empirical information, blah blah blah. But then once I was there, I was like, this doesn't. There was the improv. There's the jazz player in me. I had to say, this doesn't work. I've got to say this in a simple way or a funny way or tell a story and all these stories. And I'm like, man, I really need to like record this because you know how speakers develop scripts. I only do this training a couple times a year, so I don't know what I'm going to say on Wednesday. I know the information is there,
right?
And I have like one or two things I'm going to read, but the rest of it's just what we've been kind of ad-libbing on, and then there's different topics throughout it. I have a bit more structure because a podcast you don't have to have much structure, but it's funny. So there's the opposites. There we go, back and forth. If you have a script, you're gonna want to improv. And if you improv, you're going to make a script because you need, and that's the middle way.
The middle way. It's a beautiful integration, and it reminds me of all those things we create, all those, right? All the dialectics of this thing is so beautiful, right? We keep generating these opposites to contend with, right? And we get faced with what winds up happening becomes an integration of all these things. We wind up creating new ways, just like we've always been creating new kinds of humans. We've been creating new forms of music and art. We're always creating. And I think it's just a beautiful enterprise, the way that we're always creating new forms. We're always finding these middle ways. We're integrating, pulling these apparently disparate elements together. And when we do them intentionally, it's remarkable, right? We do them strategically, intentionally. And with this beautiful paradox of, well, and I don't have to be overly attached to that.
I got to get rid of attachment. Yeah, what they say, somebody said, take everything seriously and hold it all lightly. Did I say that right?
Oh, that's lovely.
Yeah. Take it all seriously and hold it all lightly.
Yeah.
So it's all important and it's all beautiful and it's all there, but we also have to be careful of our attachment to it. And so you see that in music, you see that in art, you see that in therapy.
I think so.
And I'm sure you see it in business and other things that I'm not.
I think so.
That aren't my wheelhouse. But for instance, yeah, I can't even. I had more thoughts there, but I love how you said that. Take it away. I lost my train of thought there for a second.
Yeah, it'll come back. The moment I start throwing some other ideas, the train will come back. Yeah.
That's how it works. And no, I love all of this discussion. And humans are creative. We're creative beings. And when we can help somebody recover from a trauma, a loss, difficulty, a season, an illness, whatever's going on, that creativity returns to the thing that they are meant to do. And I wonder about... you can take this with any population, but just right now working with the younger population who they play video games all the time. And it was interesting because I had this judgmental view of video games, and I still do. But some of the video game, because I feel like you're not imagining, you're not creating. But in some of the video games, I feel like people told me, I feel depressed after playing for hours.
Right, it's interesting
because they weren't creating. But then other people told me, you know what? I had a great time playing the video game because I connected with my friends over the microphone, and we all had a good time, and we all live in different cities now, and it was the most fun I had all week, and it's making me realize I need more friends where I live now. And it was like that awakening. So look at me judging the video game. And then another person told me, I was playing this video game, and what I realized is that in this video game, it lets you create different things, and I learned that I need to make stuff in real life too. And so I think that, we get fixated on these different ideas. My brain was saying video games are a waste of time, probably because in my youth, I didn't play many, but I felt like I was wasting my time because I would rather do art. I'd rather do music or something.
Right.
But that's my path.
Right.
Their path may be video games, and certain people, they make it their path. But then how does that help them contribute? So it's like that whole opposite thing. I don't know if that made any sense, but people are talking about the epidemic of video games, I guess is why I brought that up.
Well, I can see how we may collectively get triggered ourselves because, and what came to mind as you were talking about that, Paul, is that notion that I took from Patrick Carnes back in the 1980s about when he was working with sex offenders out in Wickenburg, out in the meadows here in Arizona. The notion of, well, guess what? These folks are presenting with they're getting sexual offenses, they're getting into legal problems, and here he is, he's faced with treatment with folks who have paraphilias and are obsessed with pornography, or they're acting out frauderism and voyeurism, and they're doing these things. And he made a really good case, I thought, of describing how their patterns really look like any other form of addiction, posing that notion that it takes more of that excitation, stimulation, some of the risks, some of the danger, and in many ways he saw that they were kind of chasing the original high, really showing showing us indications, offering us a different way of thinking of addiction. It was really not the thing outside of you so much as the effects of inside of you, right? The experiences, what's happening physiologically, you could describe it perhaps, that they're showing a pattern of addiction. Well, the reason I bring that up is that I get reminded of, if people now talk about from a more integrated standpoint, like, what does that mean? To do more effective trauma-informed, from a perspective of the whole person, the development of the organism, the adverse experiences that have influenced how that person's expressing neurologically. What is the latest version of that person showing up? As if live for the big photocopier of the original blueprint. So all of that around epigenetics you mentioned. What is if, taking all that into account as well as we know how do you treat a person who's showing up with an addiction, with air quotes, with video games, for example? Well, you could argue that it's just another manifestation of the organism. It's not so much what is wrong with the person, but rather that big paradigm shift in trauma-informed care is what's happened to the person, and to what degree is the organism self-regulating or attempting to self-regulate or to compensate.
To adapt, yep.
To adapt. And so I get reminded that maybe if you take if you apply what we've been talking about as it relates to treating anyone, including anyone who might have any number of different apparently addictive or problematic behaviors that way, that it would be with this place of radical acceptance, non-judgment, being willing to be flexible enough to consider that it serves, right? I mean, I don't want to play necessarily Dr. Phil, well, how's that working for you?
Right,
or anything,
right.
Not necessarily, but maybe a piece of that does apply here of, without judgment, what is it you get from playing video games? Again,
Absolutely.
Meet the person where the person is.
And that's what I've learned to do, is I have to take my personal opinions out of it. And my personal opinions are usually about some big global issue wrong, because it's all applied to a different. It's all applied differently to everybody.
I think.
And
it's
so
fair.
Exactly, for the clinicians out there, we aren't trying to just beat something out of somebody. We got to find out why is it important to them. What is it doing for them? Right.
That's what we Ericksonians say is, elicit only the power struggles. Even Scott Miller won't even call it resistance. Erickson used to call it resistance.
Right.
But instead of trying to beat it out of them, to consider, okay, elicit or generate only the power struggles whose energy you're going to utilize, whose energy you're going to channel, kind of like a keto.
A keto where you pull the person, use their center of gravity. Is that what you're talking about?
Exactly. I mean, and the goal becomes, again, that notion of, let's find out what it's doing for you. Let me better meet you where you are. Let me better find out what kind of function that serves for you. And while as Bruce Perry would say, as your prefrontal cortex may not be entirely open for business and you're just reacting, like you were talking about earlier.
Sure.
Well, let me make that more grist for the mill too. We can utilize, as we Ericksonians say, we're going to utilize whatever the person brings. And then I'm going to customize what I do in this collaboration with you to create some sort of relationship by which the greatest version of yourself emerges, if it's a true self or whatever you call that.
I love that. And I think that we're probably going to have to record a part 2.
Okay, I'm open to that.
So, because I'm running a bit low on the time today, but I think that was a very good last summary, because I brought up that issue and then we discussed how we contextualize it. Yeah. And I heard Ericksonian in there. I heard a little motivational interviewing.
Oh, right.
The pros of what the risky behavior or the difficult quote unquote addiction is.
Right.
I loved all of that. I think that's a good summary. I'm not going to repeat the summary. Everyone just heard the summary. So I think that's a good summary of our work. And I want to thank you for coming on the show, Randy. You. And I loved all the quotes that you just pulled out of thin air.
Thank you.
They're probably in your brain, but I had thought of like bringing in some quotes. That was my script. I brought in a few quotes,
right.
And I was like, you know what? These quotes have nothing on what Randy's throwing down. So I threw that part of the show out. I improv'd on that, and so I wanted to say, so maybe bigger organizations are listening. I don't know. So how do people get a hold of Randy Webb if they want to have him come teach their clinic or their hospital or their integrated giant behavioral health system in a different state? Or I know that you still take a few people on in therapy.
Sure.
But I know that you have no website.
Right. I've never needed. Can you believe it? And I know it sounds a little foolish to say you don't need one. No doubt, I'd make good use of it.
But you have a regular quote unquote job, right? Where you're not just an entrepreneur in your learning consultant capacity. So it makes sense. Well, no, I think it's great that you don't have a website. I think it's awesome because I don't know. It makes you the person you are, and people know who you are here in the Phoenix area. But I think I never change. Don't get a website.
Understood.
I don't know, but if people want to get a hold of you, how would they go about asking you for consultation or getting you to train? I know EMDR. They contact EMDR, and you're working for them.
Right. So a great way to contact the Humanitarian Assistance Program or the Trauma Response Network, if you want to get involved with the organization for whom I volunteer and go out, is EMDR HAP. So that's www.EMDRHAP for Humanitarian Assistance Program.org, EMDRHAP.org. And you can just click on training and ask about how to host a training or get involved in that training. And then if you would just like to send me an email message, anyone who'd be interested in that would probably be the best way to kind of start everything else rolling.
Sure.
And my email address is LLU, V as in Victor, IA 357 at gmail.com. So I love rain, so that's why my email address has Lluvia, or you can tell I was educated by Argentinians, Lluvia instead of Lluvia, LLUVIA 357 at gmail.com. And I'd be glad to respond to anything you might ask about. I can connect you with other people as well.
That's excellent, Randy. Thanks so much for sharing that. And it's been a great time hanging out with you and talking today. And I'm looking forward to coming back in the future and hanging out, maybe doing another podcast at some point.
Absolutely.
And let's see. So I think that about wraps up our show. And you found out how you can get a hold of Randy. So just wanted to say thanks for listening. And Randy, if you want to say anything else to the listeners.
Good luck to all of you out there. And I hope that you have someone in your life, including yourself, appreciating all the beautiful stuff you do in the world.
All right. Thanks, Randy.
Thank you.
Thanks, everybody, for listening to The Intentional Clinician. This is Paul Krauss, your host, and I really hope you got a lot out of that episode. I had a wonderful time recording it and learned a lot from Randy. He is a fantastic person, a kind and wise man, and just bursting with knowledge and very centered. I really am glad he's training a lot of people, so if you ever get a chance to do the EMDR Humanitarian Assistance Program training and Randy is teaching, you have a real treat. And if you're in Maricopa County, Randy does train for the large behavioral health organization that's even larger than the one I was working for that kind of oversees things. So if you can get my drift, you might be able to find out where Randy's teaching and come to one of his classes, or just email him and see if and you can connect in some way. Thanks so much again for listening and supporting this podcast. Thank you for rating this podcast and sharing it with your friends. This podcast actually shares the name of a training I created called The Intentional Clinician. I don't have a web page or anything really for it yet, but I've presented it now 3 or 4 times. This is my second time for a large behavioral health organization in Maricopa County. In Phoenix, Arizona, I presented last week a few days after I recorded with Randy, and it's a 5-hour training, and I did it through the organization so that the continuing education units will be approved by the state for licensure, and the curriculum was approved through them as well. And it's really fun, interactive training. I have multiple exercises, probably about 5 to 8, depending on the group I'm training, and then those are all interactive, introspective, about becoming an intentional clinician, and also different things you can use with your clients as well. And then there's also some lecture and some story components as well. And I'm really working on it and trying to refine it and make it even better for next time I present it in Phoenix. But if you would like me to present this in your town, just give me a phone call, 616-365-5530, or give me an email. You can find me on the web at paulkrauscounseling.com, and let me know, and I'd be love to come present to your clinicians. I'm actually thinking about making it 6 hours instead of 5 because I ran out of time last week with all the material and stories I wanted to present and the interactive activities. So that's the news there. As you might know, I am a counselor living in Grand Rapids, Michigan, and I work at a place called Health for Life Grand Rapids that has multiple other counselors, all with their own specialties, a clinical hypnotherapist also, and a naturopathic doctor who is giving education in Michigan as they are licensed in the state of Arizona and do some work there as well. And right now, I'm just trying to get the news out there about all these subjects, and obviously this podcast is just a volunteer project I'm doing, but I love doing it, and I'm really hoping to do more of this and spreading good ideas to help people wherever they are at, whether they're clinicians or people that are not clinicians or whatever they're doing. I hope that this can help them heal or feel like they're getting some good information or maybe get some better knowledge. But here we are. We do have to do a disclaimer. Welcome to the disclaimer. I'm going to try to do this in the style of an Ericksonian. The recording you just listened to consists of the personal opinions of Paul Krauss, and while these are based upon the literature he has read and the experience in the field, and that same goes for Randy Webb, they should not be viewed as the definitive opinion on the subject. Listening to this podcast is not a substitute for treatment. If you are in a crisis, please dial 911 right now, or the National Suicide Prevention Line at 1-800-273-8255. Remember, if you're in need of counseling, please find a local counselor who is licensed in psychotherapy and, in my opinion, is up on the newest and latest research, including interpersonal neurobiology, trauma-informed care, and is learning to work with the whole person and the nervous system, and also happens to be relatable and non-judgmental. That's my opinion, but if you need somebody, get to somebody soon. Thanks so much for listening, and I look forward to meeting with you again on this podcast. Randy, ¿tu comida favorito?
Yo diría que, bueno, primero que nada, yo quisiera tener un poco de bacalao. A mí me encanta bacalao, especialmente con una salsa de tomate, quizás algunas papas con queso, ¿qué más? A veces no como mucha carne, pero a veces prefiero un poco de, quizás pasta inclusive, un cierto arroz. Posiblemente, a mí me encanta todo lo que sea frijol, además. Y quizás un té, un mate o un té, quizás un té, bueno, no debería tomar té con azúcar, pero a mí me encanta el té con azúcar. Pero sí, más que nada, no, esa cosa sería una comida ideal, casi.
Ah, muy bien.
Bueno, gracias.
Sí, yo es muy hambre.
Ah, bueno.
Sí.
Sí, bueno, ahora sí tengo mucha hambre en este momento, ¿no? Sí, definitivamente. Sí, sería una comida casi ideal. A mí me encantaría en cualquier momento.
Gracias, Randy.
A usted, Paul. Un placer.
Okay, so one of the things I've been doing is
I have some really good ideas. I have all kind of things we can kick around today. Really anticipating some good ideas getting out there, comparing things, kind of analyzing things a little bit, but getting the word out as to what might be really helpful for people. It's really, I think, what we're all about, isn't it? We really want to make things be optimal for people, if at all possible. Give them some good stuff they can use.